So I made this diagram to show the different things that go into your risk level for catching and developing symptoms for coronavirus. The first thing that goes into the risk is the person themselves. They have a specific social security number that defines them from other people, and they also may or may not have pre-existing health conditions. And if you do have diabetes or asthma or another one, then your risk level will definitely go up. The next factor is age, because if you're an older person, then your risk level for developing a serious condition will also increase. Race is another factor because between races in America, it has not been proportional, such as 88, the African Americans have a chance of 88 out of 100,000 to die, and white Americans have a chance of 40 out of 100,000 to die. Gender is also a factor because females have been dying less as often as males have from COVID-19. And that person has a specific behavior that influences their risk, such as wearing a mask. Wearing a mask will keep you safer and lower your risk. If that person attends social gatherings, such as parties, their risk will definitely be increased because they'll be in close contact to other people. If that person washes their hands, then they'll have a less of a risk because they'll be able to clean their hands and get rid of all that bacteria. If a person is physically active and works out, then they will have a less of a risk because their heart and lungs will most likely be healthier. And if that person socially distances or stays 6 feet away from the people around them, then they'll have a less of a risk because of the way the particles move through the air after 6 feet. The next thing is their occupation. Um, if they work in person, then they'll have a greater risk than working at home because they'll be coming into contact with a lot of people throughout the day. If they have to travel for work, they'll have a greater risk as well because they might have to travel on an airplane with a lot of people. And the type of transportation that they take towards work, such as car, subway, or bus, if they take a subway or bus, they'll be in close quarters with a lot of people, which is also increasing the risk. And if they are coming into contact with people at work instead of working in their own office, then they'll also be more at risk. And if the company performs routine health checks for the workers, such as taking their temperature before they come in, then their risk levels will be decreased. Next is their geographical location, because if they live in a certain country, then it'll have different protocols as opposed to another country and different numbers of cases. And that applies the same for each city and town that they might live in. Each city has a different number of total cases. And population density is a big factor because if they're living close to a lot of other people, then they're going to have a greater chance of catching it. The total active number of cases in their location will influence this because if there's a lot more cases, then they have a greater chance of catching it. And the average income in their area will influence this because generally, if they are poor, then they will live in close quarters with a lot of other people, such as an apartment building, and run into a lot more people as opposed to just a single family house. Another factor is the hospital that they go to, because each hospital has a different quality of healthcare. And if it's a good hospital, then they have a lower risk. But if it's not as good, then they'll have a high risk. That hospital has a specific address that determines it from other hospitals. Throughout the hospital, you'll come into contact with a different number of people depending on the hospital and the day that you go. This will influence your risk, and the length of time that you stay at the hospital will influence it because the longer you stay, the more people you will come into contact with. And the number of patients at the hospital will influence this because if there's more people, the greater chance you have at coming into contact with others. And risk comes in many different ways, such as symptoms, which can be anywhere from a fever to a cough to even a bacterial infection in your lungs. And you can have long-term health issues as well, such as developing a heart condition. And the length of the sickness usually is about 2 weeks. The death rate depends on the person and everything above, and you will most likely be contagious if you have it. And I made a list of these tuples that show the relationships between all of the different factors that go into what I just mentioned above.